There are so many things that can affect a person's ability to access healthcare. As a health professional, it is our job to do what we can. However, we of course cannot do and see all things happening, but we can each do our part to improve what we can for each of our patients and speak out when we see bigger lateral issues. One thing I find really important that can influence any and every patient we might see is education, which also has a significant impact on health disparities. This ties into health literacy, which is the ability to find, to understand, and to use health-related information and services to make health-related decisions. If someone is unable to understand the jargon being used or other medical terms, or cannot navigate the healthcare systems, this could stop them from getting the medical care they need. Good health literacy allows for informed health decisions, which is important in both preventative and promotional health care. Health disparities can affect health promotion and preventative care in the way that, using health literacy as an example once again, preventative health care information might not be shared or easily accessed. If someone is unable to access correct or accurate information, they may not be able to take the correct steps for themselves to stay healthy, or may wait too long to reach out to a medical professional for help, which could have lasting long-term negative effects. These disparities can also affect the healthcare system, as misinformation can be easily spread, which makes nurses and doctors' jobs harder, as well as allowing people to suffer needlessly because they have incorrect information. Some things to help reduce disparities in my community would be to increase health literacy. Informational pamphlets and helping those around me to understand medical terminology is just one thing I could do. I often help my grandma out with vitamins she wants to try and understanding what they are for and what they are made of. As a health professional, you can encourage your patients to ask questions, bring questions they might have, encourage their own healthcare learning journey. Making sure patients know that an interpreter is available or that they are more than welcome to bring a +1 to help them with whatever they need. Being able to give patients other resources to research and investigate the things we are teaching and telling them to help. Learning does not end for us or our patients at the end of an appointment. Healthcare professionals play a big part in reducing health disparities, often even if they are not the cause. We can see the effects of these things, and our role as healthcare providers is we need to call these things out and see what can be improved, even if the enactment of these solutions is out of our hands. Using data to target interventions and bring light to issues is one thing healthcare professionals can collaborate to do. There are so many health disparities in the system, unjustly so. Each one of us can do our part to help patients in any way we can and continue to point out what we can do that continues these disparities.